Okay, so we're gonna go over the lab. The first thing I want to talk about is this guy here. So this is for the Invisalign tips that we have in here. We put retractors in here also. We put things in here that we can't autoclave on because they'll melt. So then I'll show you here. What we've done is once they're in that for at least 24 hours, we put them on here to dry. And then we leave them up here. The next day, we take them down. We put the tips right here. We put the retractors in here. And then I put this back up. Every day we do that. And then in here, this is basically our post-op care section. So we have whitening instructions, extraction post-op stuff, implant post-op, night guard, Invisalign stuff. We have baggies here, so we can put sterile gauze in here. We have Invisalign bags specifically. Our cases are up here. We put the sheet of the instructions in there, sterile gauze, whatever the patient needs for that specific procedure. We put that in a baggie so we can give it to the patient. Now over here, you see all of our Invisalign cases. We pull the cases for the next day and we put them right here so that they're not so hard to find in the moment. Over here we have our burrs. This is our tip out bin wall. This should be organized and clean. The bin shouldn't be tipped out like this in general, but this one just doesn't fit. Same with that one. Over here, this is where our lab cases are. The way that lab cases work, the front desk receives all the packages from FedEx, UPS, whoever it is. They open them, they check what the patient's name is, they check it in the patient's chart. It's still the assistant's responsibility 1 to 2 days prior to the patient's delivery appointment for night guard, for Invisalign attachments, for a crown seat, to make sure that they can find the case here. There's been times where the front desk has made a mistake. There's been times where somehow it was checked in, somehow it says delivered from the lab. We can't find it here. So it is the assistant's responsibility to pull those cases the day before. This is where most of the night guards are. This is where they put the crowns. It doesn't matter to me. It depends on what the lead assistant wants to do there, as long as you can find it. Every couple of weeks, we're going to want to go through these and make sure that people haven't not picked up their night guards. Like there's a patient back there. No, we made hers months ago. I'm not sure why she hasn't gotten it in, but we do try to call them. Over here, this is our suck down area for making bleaching trays. This is the vibrator that we use to make models. This is the trimmer so that we can trim our models. We pour up our models and then we put the impression tray like this and then we set here. This should always be clean. We should never have models sitting here. We should always know what we're doing with the models. Up here is our whitening stuff. Here we have preliminary impressions. We go through this every couple of weeks as well and throw out old preliminary impressions for patients that have already had their crowns put in, because we don't want this to get too messy. What else? There's a lot going on here. It needs to be organized. It needs to be clean. You need to know what's where. Extra new, brand new iTero tips are right there as well. That's what we use for scanning new crowns. That's about it right now.